This book is on global healthcare. In particularly deals with the global healthcare crisis that we are living through and the role of the pharmaceuticals and biotech industries in it. This healthcare crisis is a financial crisis in which the governments cannot provide the patients with access to two important and major things. One of them is medical attention, and the other one is access to pharmaceuticals. Healthcare is one of the most fundamental issues in the world right now. So this book deals with, in a very comprehensive way, with all the intricacies that exist in this system. In the United States, it is generally believed that the major problem is having access to health insurance. However, this book takes a different approach because it proposes that the major problem is having access to medicines, which is a common denominator among all nations. My motivation in writing this book was to create something that no one else had done before. Global healthcare is an extremely complex and complicated issue, and I believe that it is necessary to understand what are the causes of the current problems so that we can find solutions to these problems. Therefore, what I wanted to do was to create a platform, an infrastructure, so to speak, that would allow us to know and learn how medicines are made, what the role of science and innovation in the provision of healthcare services is, as well as the role that the regulatory bodies, the government, and the financial systems have in both the creation of medicine and the access that the patients would have to them. This book is organized in 4 different parts. The first part deals with the global healthcare systems. It is a comparative analysis of the healthcare systems in the United States and Canada, and in Europe, and also the developing world. So what I wanted to see was, or explore, were the limitations of the current healthcare systems right now in the world, and then find common denominators among them, the problems that are affecting them, which is mostly medicines. The second part deals with the biotech and pharmaceutical industries, the problems that this industry is having right now with patent expirations, as well as with great research and development deficiency. So this industry is going through one of the most difficult periods in its history. So I address that in the second part. The third part of the book deals with science and innovation, how medicines are created, and also the relationship between the academia and the industry, and how this process has an impact in global healthcare. And the fourth part of the book deals with healthcare in the developing world and what are the limitations, as well as social corporate responsibility, and what the pharmaceutical industry is doing to address these problems. And the final part is a conclusion in which I provide some solutions at the scientific, at the medical, the pharmaceutical, as well as the regulatory and business and public policy levels. This book project took about 6 years of my life. The actual process of writing the book took between 3 and 3.5 years, but the overall research exclusive for the book was about 6 years. The story about how I came to conceive this book is interesting because in 2006 I published an article in Nature Reviews Drug Discovery on the development of anti-cancer drug Velcade. So a good friend of mine, a philanthropist, his name is Daniel Moran from Switzerland, asked me if I was willing to write a book about this because he thought that the subject matter was extremely opposite. And I said, yes, I will be happy to do that. And then I began this process in 2004, and it took several hundreds of thousands of dollars to complete this project, but I think that this will be a tremendous contribution to society. An important characteristic of this book is that this is a very objective work, and it has been very scrupulously done. I have had to interview the world leaders in the healthcare area, as well as in the pharmaceutical industries, in Latin America, in the United States, in Europe. And for this book, I have received no funding whatsoever from the pharmaceutical industry, from the government, from advocacy groups, and it has been fully funded by Mr. Morand, so that we create a system in which we look at the problems from a very clean perspective and not influenced by particular either political or personal interests. The primary audience for this book is the professional, anyone who works in the pharmaceuticals development area, doctors, as well as anyone who invests in this field. However, the book is written in such a simple and clear way that anyone who is interested in global healthcare, the average population, the educated layman, and advocacy groups, students, anyone who is interested in healthcare can read this book. The book is very comprehensive, and every scientific terminology is very clearly spelled out, so to make sure that everybody can benefit from this knowledge. The major conclusion of this book is that healthcare reform is not only about providing the patient with a more extended healthcare insurance coverage. It is necessary a transformation of the way in which medicines are produced and how they are developed. So people need better medicines, they need safer medicines, and also they need a more affordable access to medicines as well. So a transformation of the pharmaceutical industry, lowering of the prices of medications, will have a tremendous impact in the way in which we tackle these healthcare issues. And the other perspective is that when we think about the healthcare problems, we shouldn't be thinking only about the United States problems. That is only part of it, but there are other problems in the rest of the world as well. And I think that in addressing those issues, we will create a win-win situation, both for the poorer regions in the world, as well as for healthcare in the more developed parts of it too.